Hello, my name is Jessica Dunham, and my presentation is going to be about one of China's most recognized contemporary artists, Zeng Fanzhi. Born in Wuhan, China in 1964, Zheng's upbringing was shaped by China's Cultural Revolution, a time of societal and cultural upheaval. He found comfort in artistic expression, studying at Hubei Academy of Fine Arts, where he drew inspiration from German Expressionism. His pieces, done in oil paint, heavily reflect his experiences during his youth, exploring themes such as the human condition, change, and identity. Throughout the Cultural Revolution, China only allowed artists to produce works based on socialist realism, which mandated for art to be grand, decent, and devoid of imperfection, seeking to be optimistic in its portrayal of the future. In other words, the pieces created were idealistic symbols, used as propaganda in support of the revolution. However, what was depicted in these paintings was far from the truth. Zheng's art caught attention of his professors and critics as he rebelled against socialist realism, depicting gritty scenes in their entirety. The first painting I want to focus on is from one of Zheng's earliest series, titled Hospital. Created in 1991, the triptych depicts scenes witnessed by Zheng at a hospital in his hometown where he would frequent. The first panel depicts a crowded room of patients squished together, all awaiting treatment. Their faces show anxiety and anticipation, which contrasts the doctor's assured and despondent expression. The second panel shows the operating team huddled around a patient's body, depicted in the most vulnerable and, if we're being honest, unflattering way possible. The medical staff expressions are detached and focused, prodding and probing at a body before them. The third panel shows a crowded room of patients resigned and exhausted from their procedures. They are devoid of emotion, with hollow, sunken eyes, reflecting the mental and emotional toll taken on them. Beside them, a doctor stands proud amidst the suffering. Jung depicts this piece in a way that breaks the bonds of socialist realism, displaying feeling, suffering, and individuality. The figures are warped and cartoon like, with bulging eyes and comically large hands, while simultaneously being lifelike, painted in high detail, exuding a captivating and unsettling presence. The earthy and muddy palette depicts a sense of decay, while the patient's anxious looks contrast the indifference of the doctors, suggesting a class based suffering where vulnerable patients are powerless when faced with a higher authority, such as the doctors. The next painting is from Jung's Meat series, created in 1992. Again, this series is inspired by a butcher shop in Jung's hometown, where he often saw workers covered in blood. The bright red and pink contrast the gray palette, drawing the viewer in towards the carcasses. The two figures depicted are covered in blood, barely differentiating themselves from the bodies around them. There are many meanings to this piece, however, I understand it to be an equivalency between the living humans and dead animals, showing how little individuals are valued in an oppressive society. The final piece is Jung's most recognized piece, a recreation of Da Vinci's Last Supper. Religious figures are replaced with communist youths wearing their distinctive red neckties. The figure replacing Judas is shown wearing a yellow tie. All figures don an emotionless white mask and all feast on watermelon rather than bread. The masks and red ties represent communist ideals and the cultural beliefs of conformity and collectivity, whereas the yellow tie signifies China's growing capitalist economy post revolution. The figures feast on watermelon, as that was what could be afforded by the many Chinese living throughout the revolution. This rendition provides a stark contrast between traditional values and an emerging capitalist culture, highlighting how some will eventually betray the Communist Party and their ideals in favor of capitalism. And here are my sources. Thank you.